Good evening and welcome to Doctors on Call. Tonight we're talking about the diagnosis and treatment of skin issues like acne, eczema, skin cancer, and psoriasis. I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth, and I'll be your host tonight. What would you like to know about skin problems? Call those questions in locally at 218-788-2844 or toll free at 1-877-307-8762. Here to answer those questions are this evening's panelists. Dr. Jeffrey Evanson, a dermatologist with St. Luke's Dermatology Associates in Duluth. Dr. Emily Onello, a family physician with the Lake Superior Community Health Center in Duluth and faculty member in the Department of Family Medicine and Community Health at the Medical School Duluth. And Dr. Michael Wolz, a dermatologist with Essentia Health-Duluth Clinic. Medical students answering phones tonight are Kat Dahl from Laverne, Minnesota, Kelly McKinnon from Duluth, Minnesota, and Aubrey Thielen of Faribault, Minnesota. Well, we might as well start out tonight, Dr. Evanson. We're in the middle of the winter, and my skin's dry. Do you see more common skin problems in the wintertime?
Yeah, wintertime's kind of a troublesome time for a lot of people with a fair, sort of the average skin condition. I mean, even with normal skin, like you've said, you often are very dry because of the low humidity in the air. But I see a lot of my patients with eczemas and dermatitis and things that are flaring during the winter because of that. So I'm always reminding them to take care of their skin well by minimizing their soap use and moisturizing after their baths and maybe use a humidifier in their home. And so it's very common.
Well, thank you. Dr. Onello, a common question that patients have, they'll call in and they say, I've got this thing on my arm or my hand or a growth, a new growth, and should I come in and get it checked out? What do you say to people about that?
Well, you're right. That's very common, skin concerns of all types. And as a family physician or your primary care physician, we really do welcome the opportunity to examine the skin. I think the old saying, a picture's worth 1,000 words, is certainly true with skin. Just even having a look and hearing a little bit of the story behind what's been going on is really important. And certainly my dermatology colleagues here are very helpful when we get stumped and we aren't sure what's happening. We certainly use them as a resource. But I think the question of when to go in, I think patients often know if something's new or something's changing. That's always an opportunity to get it checked out. I would always rather see something than miss something that could have been treated.
Sure. Dr. Wolz, a lot of people wonder about, and they've heard about this Mohs surgery when people have a skin cancer, say. Sometimes there's further surgery. It used to be people would just cut out the area and put a couple stitches in and be done with it. Now, what's this Mohs surgery all about?
Yeah, it's a great question. Well, compared to the traditional surgery, Mohs surgery is microscopically controlled surgery, meaning we're doing microscopic analysis while we're doing the surgery, which allows us to take less skin. Essentially, the goal is to take off the tumor while also sparing the healthy skin around it. In the traditional method, we take out more skin around to make sure there's a safety margin. That safety margin is not necessary in the Mohs, which allows us to create smaller defects while still removing the whole tumor. It's particularly useful in the face where we don't have that much skin to deal with.
Mm-hmm. And then after the Mohs surgery, do things just heal up on their own, or do people have to have further treatment?
Yeah, there's all kinds of wonderful reconstruction methods and plastic surgery. Often we can do it right there in the office, some simple closure, sometimes we use flaps or grafts. And we also work closely with our colleagues, the plastic surgeons, the ENT surgeons. At Essentia, we are very grateful that we have the ENT surgeons right next to us, so we can work with them very closely.
Very good. Dr. Evanson, do you see any certain types of skin cancers in this area compared to other areas, or is a skin cancer a skin cancer?
I certainly have seen my fair share of, the sort of the main types of skin cancers: squamous cell, basal cell, and melanoma. I would say that we have our fair share of it here. Some people ask why, when we live in an area that, doesn't get so much sun and is always cold, and, but we certainly have, plenty of fair-skinned people and a lot of recreation time and lakes and so forth. So we're spending enough time outside and still getting that sun damage that lends to those cancers.
So it's not just people in Florida or California.
No,
Okay.
no, unfortunately.
All these
no.
Scandinavians up here.
That's what a lot of it, yeah.
Thank you. Dr. Onello, we have a caller from Gilbert would like to know, what's a good soap to use for dry skin in the shower?
I was wondering if anyone would ask that. I certainly will try and answer, but I defer to my colleagues here on that one. Each individual's skin is very different, different types, levels of oiliness or dryness. And so it'd be hard for me to say across the board a particular type. You had mentioned avoiding harsher soaps, and so a lot of I think of the ones that claim to really clean your skin very thoroughly tend to be the harsher ones.
Sure.
I know I've heard of Dove as a brand. I'm not endorsing Dove in particular, but I think of that as a more gentle soap. I don't know if my colleagues want to chime in here on what you might recommend.
I tell my patients that soap is soap, and any soap generally is going to be harsh on your skin. Dove, yes, it's maybe a little bit better, but and there's moisturizing soaps, but they all still have sort of a drying effect to them in a sense. I like some of the synthetic cleansers for people that are real sensitive skin, like the Cetaphil cleanser, and Vanicream has some cleansers and things like that. So something, in that line.
Thank you. Dr. Wolz, I have a caller from Marengo, I believe it is, wondering, is there any cure or treatment for psoriasis or bad case of psoriasis?
Well, there are definitely treatments. I'm not sure that we have a cure yet, but we can control it well. It depends really how severe the psoriasis is, and we start with topical treatments, creams, ointments sometimes, and go over other therapy options like phototherapy, where we have special light booths for a patient, to even drugs that are taken by mouth or injected. So there's a whole gamut of possibilities.
Thank you. Dr. Evanson, we have a caller wondering about fungal infections of the toenail. What kind of treatments are there for that?
Wow, I wish I had a magic wand for that.
That's another tough one.
It's a tough one because they're just they're difficult to really thoroughly treat. We can maybe make a dent and give them some, there are some topical medicines that you can paint on that are like nail polish basically. They're not real effective, but we do have some pills that can be helpful for that. A reasonable effectiveness for those, but still they seem to have a high rate of recurrence no matter what you do. Good good nail care and foot care is important, and keeping them trimmed and minimizing trauma, and good fitting shoes and all those things. But sometimes it's difficult to get it to go away permanently.
Thank you. Dr. Onello, we have a caller from Duluth wondering to know, are skin issues in the legs more common in diabetics than in non-diabetics, or can there be more worrisome ones?
That's a super question, and it's a question that kind of broadens the conversation a little, because the caller has a good insight that many systemic diseases can show themselves with skin manifestations, we would say. So certainly the things that a diabetic might be at higher risk for, such as insufficient blood supply to the extremities if things are very advanced, or damage to the nerves to the extremities. So what comes to my mind anyway would be skin breakdown possibly, but certainly by no means all people with diabetes, but this might be after many decades, or if the disease has not been well controlled. What the caller may be hearkening to is that we get concerned about things on the skin in diabetics because they often have lost the sensory ability to detect a problem. So they may be more prone to a trauma that could get infected that they may not detect because they can't feel it. So we do have you check your feet for that reason when you have diabetes.
Thank you. Dr. Wolz, a caller from Superior would like to know, is there a safe way to permanently remove age spots?
Permanently, I'd have my doubts with any of these spots, and there are lots of different methods and lots of different cosmetic possibilities. One could consider, peels, cryotherapy, But the important thing to keep in mind that, as one gets older, and one hopefully does, one gets more age spots. So there's not really, you will be sort of chasing your tail a little bit.
Yeah, I know how that goes. Okay, well, thank you. Dr. Evanson, this is an interesting question, and it kind of leads into a little bit, although I wanted to ask too, but a caller from Duluth wants to know, she says questionable melanoma diagnosis. Now, maybe he hasn't been diagnosed, but how can I get an appointment faster to get in to see a dermatologist? Which sort of brings up the question, why aren't there more dermatologists? Or are they, obviously everyone's really busy. I know it's difficult to get in to see a dermatologist, not just in this area, but many areas.
Yeah, I think first of all, why are there so few dermatologists? We're just having a hard time getting people to come up and want to live up here. It's surprising in this beautiful area, but it's still difficult to get them to come here and out of the big cities to want to be out in outer state Minnesota. But that's a lot of it. We're still working on it, but still short. As far as those kind of things, anything that's new or changing or sore or bleeding, we do what we can to get them in as quickly as we can. If they're calling us and describing a lesion that might be a melanoma like that, we certainly do what we can, or we may defer them to their primary physician for a first look and say, hey, maybe they can get you in a little sooner, and then we'll take it from there after conversing with them. So that works well. That's
a good point too, Dr. Onello. I mean, you certainly see a lot of people first with their skin issues. I mean, primary care. I think I'd heard you talking before the show. There's a lot of primary care physicians that do a lot of dermatology in this region.
Yes, I think Dr. Evanson's explanation is excellent, because then if you have your regular physician that is also endorsing that this is a concerning finding, often they can work together with you to get that appointment. And I would agree that our dermatologists do everything they can. If something needs to be seen, I've never not had a person seen promptly.
Sure, thank you. Dr. Wolz, a caller from the North Shore, would like to know, what is the difference between scleroderma and skin cancer?
Oh, that's an interesting question, and one that already shows some expertise on the caller's part. So skin cancer is what most people think about with melanoma, basal cell, and squamous cells of growths on the skin that come up and that need to be removed because they can grow. Scleroderma is more of what's called a connective tissue disease, often falling in the realm of rheumatology, actually, and who work in conjunction with dermatologists to lead it. So it's more of a systemic condition that affects the skin, and the skin becomes sclerotic, meaning thick or scar-like, as opposed to the skin cancers where you have individual lesions that present the cancer.
Thank you. Dr. Evanson, a caller from Moose Lake has Robert's disease, which are lesions on the back. Any treatment suggestions? Do you know? Does that ring a bell?
Disease. That's not ringing a bell with me.
Didn't ring a bell with me either.
I have to admit,
I don't.
Okay, I'll have to look that one up afterwards. I actually have a little app on my phone that gives all the the eponyms for diseases, but that one I haven't.
We have a lot of them, but I don't remember that one.
Ring a bell. Okay, well, thank you, Dr. Onello. Caller, this is a common one now. Why do I bruise so easily? A caller from Duluth.
Yes, very common in the office too. I sort of would respond to that with a question back to the caller, if I could, if it's something new they've noticed, or if they've sort of been lifelong easy bruisers. The lifelong easy bruisers could be because their skin may be perhaps lighter in pigmentation and they notice their bruises more, or maybe as we age, sometimes the skin becomes a bit more fragile, the capillaries can rupture with a little trauma. But certainly in the very small percentage of cases of folks who are worried about that, there can be a more serious condition where the body has sort of been compromised in its ability to form blood clots and stop bruising or bleeding in the skin. So I would say to a patient, if it's something new or it seems to be progressing, or certainly you see other signs of bleeding in addition to the skin bruising, such as your gums bleeding, then you would want to seek medical attention, and some testing can reveal further information on that. But in most cases, in my experience, it's often not something serious.
Good, thank you. Dr. Wolz, so we have two callers here with sort of the same question, and it's a good one. They're wondering, one from Moose Lake, one from Duluth, they're wondering what's the difference between psoriasis, seborrheic dermatitis, and eczema, and how do you know which of those it is?
Yeah, excellent question. That's sort of the bread and butter of dermatology. We often see these conditions frequently in the office. They're all chronic inflammatory skin diseases, meaning the skin becomes red, inflamed, and uncomfortable. So they do have that in common. But the underlying pathology or what causes the disease is a little different. And once the disease becomes more severe, the treatment starts differing. In the early stages, the treatment can be very similar, perhaps adding to the confusion in these cases. But psoriasis is sort of a disease with a genetic focus, and we talked a little bit about the treatment options there. Eczema is often a generic term for general inflammation of the skin, but sometimes when people say eczema, they actually mean atopic dermatitis, which is the most common form of eczema, often starts in childhood already. And then seborrheic dermatitis is typically an inflammation of the skin of the scalp, the eyebrows, the nose, often the central face, and there are some special treatments that we can apply to each of these conditions.
Thank you. Maybe this is related, Dr. Evanson, maybe it isn't. A caller from International Falls has a red, dry, flaky skin on his nose that burns like fire at times. Does that ring a bell?
Well, it could. It certainly could be the seborrhea that, if it's alongside the nose and it gets flaky. There can be lesions on the nose that could burn or be sensitive, like a precancerous lesion, like an actinic keratosis. Could maybe even be a little rosacea, or there's some other more serious rashes that occasionally we see, but they're very rare. But those would be probably the more common things that we'd see on the nose.
Sure.
So,
thank you. Dr. Onello, we have another couple of callers, one from Chisholm, one from Highbridge, Wisconsin, wondering about vitamin supplements and particularly vitamin D in our area. Are they good for the skin, or should this person just stand in front of a full spectrum light, a light box thing?
That's a great question, and certainly I'm sure you could do another whole show on vitamin D. I think what I would pose is, what does good for the skin mean? And I guess to me as a physician, good for the skin means that the skin is hydrated and has the nutrients it has to function in its role as kind of a protective and immune barrier, and other functions that it does for the body as a sensory organ. So to me, I would answer that question very basically, that a good, well-balanced diet with adequate nutrition and vitamins and minerals should be sufficient. I certainly will leave a moment for my colleagues to comment, but I don't know of any particular need to go out of your way specifically for the skin beyond adequate rest and good nutrition.
Thank you. Thank you. Dr. Wolz, a caller from Iron River, has granuloma annulare. Does it ever go away, and what can you do about it?
Yeah, it often does go away, actually, and in most cases it goes away, particularly if it's self-limited, if it's localized, meaning it's only on a certain area of the body. It can be generalized, in which case we often say you should see your primary doctor too, because it can be associated with other conditions like diabetes. But it's often, self-limit goes away. In the meantime, we often use topical corticosteroids, or sometimes even intralesional, meaning we inject it to help speed up the process of them going away.
Thank you. Dr. Evanson, a caller from Duluth, how effective is aloe vera for skin difficulties? Is that something, does that have anything?
It does have some sort of anti-inflammatory effect to it. It's minor, but as evidenced by some of the sales for sunburn and so forth, it does have some minor anti-inflammatory effect. I don't know that you're going to get great response to some of your more involved eczemas and psoriasis and those kind of things, but for minor irritation or a sunburn or something, it's fine.
Great, thank you. Dr. Onello, or whoever wants to answer this one, because although the caller called in, this is my question too. Tips on healing dry, cracked fingers, like on the end of your fingers and thumbs. You get those cracks that hurt.
Yeah.
What do you do with that?
Well,
You're gonna have to
I'm not sure I have
suffer?
a medical answer here. I have heard everything from super glue to Utter Balm, and I think they're sort of the practical things and prevention. I know once they're there, they're hard to get rid of and they often come back. But Vaseline, I know sometimes some folks will wear the cotton gloves you can wear at night. You can purchase them at the pharmacy once you've hydrated the skin with some moisturizer. So that would be my thought. I'm certainly open to
Yeah, I
suggestion.
completely agree. That's a
Okay.
good summary.
Yeah.
Good summary.
Yeah, and I do like the super glue idea too.
do?
I do.
Okay.
Yeah.
Oh, is that right?
Yeah, into serious cracks, if you put it at the end of the crack, it can kind of keep it from spreading. I mean, it's not really a treatment, but it can limit the spread of the crack. So, yeah.
Great. Well, thank you. Dr. Wolz, here's a caller from Bridgedale. I don't know where Bridgedale is. Do you know? Have you heard of that? Anyway. Chapped hands in the winter. They make a paste out of chaga mushroom and olive oil. Have you heard of that one? There's a lot of home remedies, aren't there?
I'm actually personally a big fan of home remedies if they work for the patient. So as long as it works for you, I'm happy with it usually. There are some things that can cause harm, particularly if you keep going despite it not improving, or sometimes it can cause what's called an irritant dermatitis, or where people become allergic to the substances they put on. But if it works for you, I'm very happy.
Well, thank you. Here's a question too. There's all this hydrocortisone cream. You can buy it over the counter now. A lot of people use it. Is it reasonable to use over the counter medications like that?
Yeah, I mean, I think that's reasonable to start with. If you've got a inflammatory condition and you know it's a itchy rash or some of the seborrhea we talked about, or an eczema, to start out with some over-the-counter hydrocortisone cream. It's mild. It's relatively safe, and short of putting it in your eye or something, I mean, it's safe, but yeah, I would say start
But just
there.
try it for a while, and if it doesn't work, well, then you should.
Yeah, give it,
get it checked
if you
out.
give it a couple weeks or something, then
Sure.
I'd move on to your doctor or.
Sure.
Yeah.
Terrific. Dr. Onello, here's a good question. A caller from Duluth wants to know, should I get a mole removed by a dermatologist or a family physician?
That is a good question.
A good one?
Wow. A little more complicated answer. I think certainly sometimes location makes a difference, the age of the patient and the desired cosmetic result, but I believe both are qualified to remove moles. The question often comes up if there's a high suspicion that it may represent something more ominous, such as a melanoma skin cancer. Typically, there's a very structured way you would want to approach that. And so in those cases, if it's not purely a cosmetic removal, you would want to make sure that your regular physician is working with a specialty team to make sure it's done correctly.
Thank you. We just have a couple of minutes left. Dr. Wolz, a caller from Grand Rapids, wants to know, what is lichen planus? A dentist found it inside her cheek.
Yeah, good question. So lichen planus is another inflammatory skin disease, and it does often present in the mouth, on the gums, and the insides of the cheek. Often it requires treatment there, again with some anti-inflammatory medication, but in these cases it's usually good to do a sort of multidisciplinary approach with the dentist and the dermatologist both working together to address that.
Okay. Thank you. Dr. Evanson, a caller from International Falls, what are the skin symptoms of lupus?
Lupus can be another one of these red scaly rashes, which can look like some of these other things we've talked about. Often is in the skin or in the sun exposed areas. Could be on the face or on the hands or arms. It tends to be red and scaly. Yeah. What else would you like to hear about that? That's about it.
The
Yeah.
stereotypic
The
rash
stereotypical,
might
yeah.
involve the upper cheek.
Sure.
But
It depends on the type of lupus. There's a systemic form of lupus, which is a true generalized autoimmune disease, and you can get kind of a flushed rash. And there's others that are more psoriasis-like, where you get a red scaly patch on one area of the face. It's often sun sensitizing, so it'll get worse in the sun. So.
Well, thank you. I guess we're out of time. I'd like to thank our panelists tonight, Dr. Jeffrey Evanson, Dr. Emily Onello, and Dr. Michael Wolz, and our medical students, Kat Dahl, Kelly McKibben, and Aubrey Thielen. Please join me again next week for a program on lung problems, when my panelists will be Dr. Wayne Elmer, Dr. Paul Sanford, and Dr. Andrew Wilson. Thank you for watching, and good night.